Hi guys, I'm Max. I'm just gonna show you guys a few ideas on when I fill and when I don't fill a cavity. So this diagram, it shows us 4 different types of cavities: incipient, moderate, advanced, and severe. Incipient, it's just on the enamel. You can see it hasn't broken through into that dentine. I never fill this, and I just don't think any dentist should pick up a drill to fill these. Moderate, most of the time I still don't fill these because it's still restricted to the enamel. It's just about reach the dentine, but with good oral hygiene and a good diet, I think this is going to be fine. I actually have a cavity like this in my mouth, and it's been fine for 10 plus years. So most of the time I don't fill these. Advanced is when it gets a lot trickier because it's got through the dentine, and the dentine's quite soft, so it can go from the dentine to the nerve really quickly. So most of the time I do fill them. There are exceptions to the rule, like if you're a really diligent patient, you can still maybe leave it, but it gets really risky. Severe is when the options become pretty bad. The chance of a root canal is pretty high. So it's either a really deep filling or a root canal. So this is what we're trying to prevent. Alright, so not every cavity needs to be filled because decay can sometimes spontaneously stop. And there's kind of research that says under lab conditions it can reverse, but in real life, even if it halts and it's not advancing, I think it's still a win. Especially when the cavity's in the enamel, with good oral hygiene and a good diet, the cavity can stop in its tracks by itself rather than us intervene by drilling and filling. There are 3 things you can do to make sure the cavity stops by itself. One would be to use a fluoride toothpaste. Nutrifluoride toothpaste is especially good if you're a high-risk case because it's got more fluoride than the average toothpaste. Tooth mousse, pretty big fan of tooth mousse. I think that works pretty well. Last thing would be to make sure you've got a good quantity and quality of your own saliva. So drinking plenty of water, making sure you use sugar-free gum after meals. Yeah, just make sure you don't get dry mouth because a dry mouth almost always has a higher decay risk than a normal mouth that's well lubricated by saliva.